I've been having dreams, jumping on a trampoline, flipping in the air. I never land, just float there. As I'm looking up.
Hi everyone, welcome back to LPT Life. I got my helmet on today because today we need to hold on really tight because we're going to be talking about several ways to avoid medication errors. So let's get started. Hi everyone, my name is Mel, and if you haven't been to my channel before, I'm a California LPT and we do nursey stuff just in the psych field. But anyway, so welcome to my channel. Today we're going to be talking about, like I said, several ways to avoid medication errors. You know, as psychiatric technician nurses, we always are passing medications or we're giving emergency medications as ordered by the physician. So it's important that we recognize different ways to avoid medication errors so that our patients can be safe and we can keep our license. So in school, they teach us the lovely rights, right? The medication rights. So when I was in school, it was only 5 rights. Now I hear that it's 8. It's 2019. I hear that it's 8 rights now. And let's see if I can get them. So number 1, you need to have the right patient. Number 2, you need to have the right medication. Number 3, you need to know the right time that you're giving the medication. Number 4, the right route. Number 5, the amount. Number 6, the reason why you're giving the medication. Number 7, refusal. Can they refuse? I don't know. That's got to be documented. You need to look at that. Number 8 is the documentation. You got to be able to document what you're giving. So as psych nurses, it's critical. Like I said, when administering these medications, you got to be able to recognize ways to avoid making an error. Some of the ways you can avoid making an error is by minimizing your distraction.
Hey, miss. Do you think it might be possible to turn that music down so maybe a couple of the boys could talk?
How about taking your time? You need to be able to take your time. Don't even let the patients rush you, especially when you're new. Maybe you're a new nurse, or maybe you're new to the floor. Maybe you're new to that unit. Either way, take your time. No, it's not worth it to make an error. Just take your time. Another way to avoid medication errors is simply asking for clarification. When in doubt, just ask another psych tech that's around you, another nurse that's around you, or if you have the doctor available, you can ask the doctor. And definitely I would choose that over making a huge medication error. Only pass what you pull. You will be working out there and you will see nurses pulling medication and giving it to another nurse. Yeah, I don't particularly like that because errors can happen and you definitely want to avoid that. So
only pass what you pull.
Another way to avoid medication errors is making sure you use identifiers for your patients. So oftentimes the MARs will have pictures of the patients in the MAR, so you can then look at the patient and recognize that that's the patient. However, you may work at a facility where that does not happen because it may be more of a outpatient thing or maybe just an acute psych unit. So you need to be able to use identifiers when giving that medication. So basically asking them their name before you give the medication. Also, you can ask maybe the date of birth. Anything that's going to identify them, so then you can actually give the medication to the person that it's prescribed to. Another thing you want to do is make sure you double check allergies before giving medications. I have seen time and time again where this has been overlooked and a patient has received a medication that they are allergic to. Yeah, definitely want to avoid that. Quadruple check your orders before giving the medication. So making sure that you're looking at the MAR, looking at the med, looking at the MAR, looking at the med, looking at the MAR, looking at the med. At the end of the day, psychiatric nurses, you make sure that you trust your instincts. So if there's ever a time where you don't feel comfortable, if you don't think that something looks right in the MAR, maybe it was transcribed kind of weird, and you're just like, what the heck is this? Trust your instincts, dig a little deeper, look at the documentation, ask the doctor, make sure you get clarification before giving that medication. At the end of it all, ensure all your documentation is completed with the correct patient. So when the next shift comes on, they know exactly what you gave. Remember, administration of medication is a serious role, so you definitely want to be able to prevent these type of errors while you're working in the field. But remember, people, mistakes happen. So just know the policies and the protocol for what you do in case you make a medication error. It may happen, and you got to be able to know exactly how to disclose those errors and what you need to do according to policy. Thanks for watching my video, guys. You have been great. Make sure you subscribe, like, comment, and if to help us not make medication errors in our futures, definitely leave us a comment below, and we will be happy to incorporate that in our day-to-day nursing style. And thanks for watching. Bye.